The thigh, hip, groin, and pelvis, acute or traumatic injuries. Quadriceps contusions. Quadriceps contusions are the result of a severe impact to the thigh, which consequently compresses against the hard surface of the femur, or the thigh bone. This often causes deep rupture to the muscle tissue and hemorrhage occurs, which is followed by inflammation. A quadriceps contusion is one of the more common injuries seen in athletes competing in contact sports and typically results from a direct blow to the front of the thigh. This type of injury often goes untreated and may result in serious complications for a patient. If there is a major untreated and/or unresolved bleeding deep in the muscle tissue, a serious condition known as heterotopic ossification may occur. Heterotopic ossification is the result of a hematoma within a muscle that then calcifies rather than heals. Rather than the body healing the hematoma with fibroblasts, baby collagen fibers, the body lays down baby bone cells, resulting in a bony growth deep in the muscle tissue. This essentially means that the muscle tissue is replaced by bony tissue. Common signs and symptoms for quadriceps contusions include immediate pain, bruising or ecchymosis, and limited knee flexion. The initial treatment is critical in the successful outcome for a moderate or severe quadriceps contusion. Proper adherence to a treatment protocol can minimize the possible complications with this type of injury. Immediate treatments include the use of price or rice with the focus on the immediate application of ice to reduce bleeding and swelling within the muscle tissue. Because it is not possible to foresee how much bleeding will occur in the muscle, it is best to treat moderate thigh contusions conservatively. The patient should be immediately pulled from participation. Continued activity will result in increased bleeding into the thigh because the heart is pumping harder and faster during physical exertion. This may result in a prolonged rehabilitation to remove the resulting hematoma and return full function to the leg. Unlike most injuries, a quadriceps contusion needs to be treated with a unique positioning of the patient. The patient needs to be positioned with the knee bent to maximal flexion while an ice pack is applied. It is best to apply an ACE wrap or an elastic bandage to hold the knee into this position. This is done to maintain the flexibility of the quadriceps muscle group while swelling may be present. The purpose of this position is not to stretch or enhance the flexibility of the muscle group, but only to maintain its functional integrity and its original length. After the ice treatment is completed, a 6-inch compression wrap should be applied to the thigh, using slightly overlapping circles, beginning at the knee and working up the thigh. The compression wrap should be snug, but not too tight. Circulation needs to be maintained. The wrap will provide a mechanical barrier to help keep the swelling out of the muscle tissue. If the patient has pain while walking or is limping, then the patient should be placed on crutches and be in a non-weight-bearing position for the first 24 to 48 hours. Pushing through the pain is not an option with this type of injury because of the seriousness of the complications. Patients should be encouraged to continue the use of crutches, moving from non-weight-bearing to partial weight-bearing as pain diminishes. Strains. Muscle pulls are strains, or in severe cases, tears of the muscle fibers. People commonly refer to strains as a pulled muscle. According to the American Academy of Orthopedic Surgeons, the thigh muscle is the most common place for a strain or a tear to occur. Common areas for thigh strains to occur are at the quadriceps muscle group, hamstring muscle group, or even the groin muscle group, which is often either the adductors or the hip flexors, with strains of the hamstrings being the most common. The signs of a thigh strain are sudden and severe pain during exercise, along with a snapping or a popping feel. Sensation, pain in the back of the thigh or lower buttock when walking. Straightening the leg may be difficult, or bending over can also present challenges. The individual may complain of tenderness or bruising. Severe strains can be agonizing, making it impossible for the patient to walk or even stand. If a patient has sustained a grade 1 or a grade 2 strain, follow Price or Rice. NSAIDs and a wrap or a sleeve are proper management protocols. If it is a grade 3 strain, then the person will need to be referred to a physician, preferably an orthopedic physician, and will most likely need surgery to correct the damaged tissue. A hip adductor or adductor strain. A groin strain. This could include a hip adductor or a hip flexor strain. A hip adductor or adductor or groin strain is one of the more difficult problems to diagnose. This type of injury occurs from running, jumping, and twisting with hip external rotation, or from a severe stretch, such as stretching to reach a base or slipping on a floor. Patients will describe a feeling of a sudden twinge or tearing during the movement. The muscle strain will produce pain, weakness, and internal hemorrhaging. To manage the condition, Price or Rice and NSAIDs are the first line of defense. For the first 48 to 72 hours, you will need to determine the exact muscle or muscles that are involved to treat this individual appropriately. Rest is critical. Daily whirlpool and cryotherapy and moving into ultrasound treatment may be helpful. We will need to delay exercise until the patient is pain-free during active range of motion. Restoring normal hip range of motion and strength and providing support for the hip with an ACE-wrap can be helpful. Rest is extremely critical for this type of injury. Pelvic ring fractures. In pelvic ring fractures, the pelvic ring is disrupted anteriorly and posteriorly in 2 or more places. The pelvic ring is composed of 3 bones, the paired innominate bones and the sacrum. The pelvic bones are stabilized by supporting ligaments. This condition is common in elderly patients, and the most common cause in the elderly is from a fall. But the most significant fractures involve high-energy forces, such as those occurring in motor vehicle crashes, cycling accidents, or falling from a significant height. Complications are likely to result in cases of excess blood loss or puncture to certain organs, possibly leading the patient to experience shock. Swelling and bruising may result, more so in high-impact injuries. Pain in the affected areas may differ, where severity of impact increases its likelihood and may radiate if symptoms are aggravated when one moves around. Management of a pelvic ring fracture includes immediate referral, checking for a distal pulse, and treating the patient for hypovolemic shock. Hypovolemic shock is a condition in which there is a decrease in blood volume, most likely due to excessive internal bleeding or from complications associated with a fracture. A diagnosis for this condition is typically made based on the history, the clinical features the patient is presenting with, and special investigations, usually including X-ray or a CT scan. Because the pelvis cradles so many internal organs, pelvic fractures may produce significant internal bleeding, which may be visible to the clinician. Emergency treatment consists of advanced trauma life support management, and after stabilization, the pelvis may need to be surgically reconstructed. Femoral fractures. A fractured femur is a breakage in the thigh bone, also known as the femur. The femur is the longest, strongest, and heaviest bone in the human body. The strength and the size of the femur means that under typical circumstances, a large force or extensive trauma is needed in order to result in a fracture. Motor vehicle accidents and falls are examples of common accidents that result in a fractured femur. Conversely, femur fractures that occur after low-energy trauma suggest the presence of some type of underlying bone condition. A fractured femur in a child may also signal child abuse, so these are things to think about. Symptoms of a fractured femur can include severe pain, bleeding, deformity of the leg, tissue swelling, and being unable to move the leg. Blood loss can be severe and may lead to hypovolemic shock for the patient. In some cases, the bone fragments may protrude from the skin, also known as an open fracture. Fractures of the femur are commonly associated with traumatic circumstances that may result in injury to other areas of the body as well. Treatment of a broken femur involves the restoration of the normal anatomical position of the bone fragments, referred to as a reduction of the fracture. The exact method used to treat depends upon the individual situation and must take into account the extent and the nature of the break, as well as the treatment for any other injuries found on the body. Both surgical and non-surgical treatment options may be considered. A fractured femur is an emergency situation. We should seek immediate medical care by calling 911 or the emergency medical number. For serious symptoms, such as trauma followed by the inability to move a leg, severe pain, swelling, bleeding, or deformity. Also be prepared to treat for hypovolemic shock. A pelvis or femur avulsion fracture. An avulsion fracture occurs when a piece of bone tears away from the site where the muscle attaches to the bone. Muscle attaches to the bone by a thick tissue called a tendon. When a muscle contracts quickly or forcefully, it can cause the tendon to pull off the bone. A pelvic avulsion fracture refers to a broken part of a bone that occurs in the pelvic area, which includes the hip, buttock, and upper thigh. Several muscles in the pelvic area can cause avulsion fractures and pain at different areas along the pelvis, especially where there are open growth plates in children and younger teenagers. These types of fractures are often caused by sudden, forceful contractions of the abdominal muscles, the hip or thigh muscles, or the hamstring muscle group. Irritation of the growth plate can also occur without an avulsion fracture, which is known as an apophysitis. In an apophysitis, there is a traction injury to the tissue, which means that the body is going to respond by laying down more bone tissue, which can often result in a little bony outgrowth to try to prevent the tendon from rupturing off the bone. Young athletes, especially adolescents at the end of the age of puberty, are at the highest risk for pelvic avulsion fractures. Pelvic avulsion fractures are frequently seen in sports that require sprinting, rapid changes in movement or jumping, such as track, tennis, soccer, and hockey. This can also occur in athletes who have tight muscles or who fail to properly warm up and stretch prior to exercise. Pelvic avulsion fractures typically cause sudden, severe pain at the site of the bone injury. Other symptoms include swelling, bruising, limited motion, painful motion, and an inability to bear weight or limping. Some common sites of pelvic avulsion fractures include the iliac crest, or the top of the hip bone, the front of the pelvis, and the ischial tuberosity. This is the buttock area, or also known as the sit bones. Pelvic avulsion fractures require a long period of rest and change in activity in order to heal. Typically, these injuries will get better with 4 to 6 weeks of complete rest. It is recommended to place the joint in an elastic compression spica to immobilize the joint, and then use crutches for the first 1 to 2 weeks. Immediate referral is necessary to determine if the torn bone piece is very large or if it is torn away from its original location by a large distance. In these cases, surgery may be recommended. A hip dislocation. Dislocation of the hip is an uncommon injury to the hip joint. Dislocation occurs when the ball-shaped head of the femur comes out of the cup-shaped acetabulum that's set in the pelvis. This may happen to a varying degree. A dislocated hip is much more common in females than in males. 9 out of 10 hip dislocations are posterior, meaning it goes out the back. In a posterior dislocation, the affected limb will appear to be shorter. The leg will also have an adducted and internally rotated appearance. In an anterior dislocation, the limb will appear to be longer. It will also have an abducted and externally rotated appearance. In both cases, the affected leg is virtually immovable by the patient and is usually extremely painful. When managing a hip dislocation, early referral is important. It is important to suspect a possible fracture or labral tear, as the force needed to dislocate the hip is pretty significant. Check for distal pulse on the patient and treat for hypovolemic shock. An acetabular tear. The acetabular labrum is a ring of cartilage that surrounds the acetabulum of the hip. The anterior portion is most vulnerable when the labrum tears. It provides an articulating surface for the acetabulum, allowing the head of the femur to articulate with the pelvis. It is estimated that 75% of acetabular or labrum tears have an unknown cause. Tears of the labrum have been credited to a variety of causes, such as excessive force, hip dislocation, capsular hip hypermobility, hip dysplasia, and hip degeneration. A tight iliopsoas tendon has also been attributed to labrum tears by causing compression or traction injuries that eventually lead to a tear in the labrum. Most labrum tears are thought to be from gradual tearing due to repetitive microtrauma. Incidence of labrum tears increase with age, suggesting that they may also be caused by deterioration through the aging process. Labrum tears in athletes can occur from a single event or from recurring trauma. Running can also cause labrum tears due to the labrum being used more for weight bearing and taking excessive forces while at the end of the range of motion on the leg. Sporting activities are likely causes, specifically those that require frequent lateral rotation or pivoting on a loaded femur, such as in hockey or ballet. The prevalence rate for a traumatic hip injury that causes a tear of the labrum is pretty low. Less than 25% of all patients can relate a specific incident to their torn labrum. However, they are often a result of a dislocation or a fracture. Falling on an individual's side causes a blunt trauma to the greater trochanter of the femur. Since there is very little soft tissue to diminish the force between the impact of the greater trochanter, the entire blow is transferred to the surface of the hip joint. Since bone density does not reach its peak until age 30, hip traumas could result in a fracture. Tears of the labrum can be classified in a variety of ways, including morphology, etiology, location, and severity. The management of acetabulum labral tears may include crutches if full weight bearing is difficult, referral to a physician, and potential imaging of the hip to determine the extent of injury. A hip pointer. A hip pointer is a contusion on the pelvis caused by a direct blow or a bad fall at the iliac crest, and or the hip bone and a bruise of the abdominal muscles, typically the transverse or the oblique abdominal muscles. The surrounding structures, such as the tensor fascia lata and the greater trochanter, may also be affected. The injury results from a crushing of the soft tissue between a hard object and the iliac crest. Contact sports are common causes for this type of injury. Most often we see this type of injury in football, soccer, and hockey in general due to improper equipment and placement of the padding. The direct impact can cause an avulsion fracture where a portion of the bone is removed by a muscle. The pain is due to a nerve that runs along the iliac crest, which makes this a very debilitating injury. This pain can be felt when walking, laughing, coughing, or even breathing deeply. Signs and symptoms include immediate pain, bruising, and swelling, obvious signs of weakness, spasm, and a rapid decline in hip or leg function, resulting in a decrease in the range of motion. Management for a hip pointer will include rest, price, and NSAIDs. Crutches may be used if walking is painful or difficult. The area should also be protected to avoid further injury. A donut pad may be very effective in helping to protect hip pointers from further injury.